సో సర్జరీ కాకుండా పెయిన్ మేనేజ్మెంట్లో ఎలాంటి ట్రీట్మెంట్ ఉంది మరి ఇందులో?
సో
ఎలా ట్రీట్ చేస్తారు అని?
as I was trying to tell you, once you identify where the pain is coming from, for example, you could be having a problem coming from the disc, which is the most common thing I told you, but then you could be having a nerve which is getting compressed by the bulged disc, which is happening within the spine, which is what we call it as sciatica. Okay, with a lumbar back pain, if the pain goes down into the leg, it's called sciatica. That is the disc bulge compressing on the nerve. So when this thing happens, so when these kind of problems are happening, you identify exactly where it is happening. We have very advanced investigations these days. For example, we have an MRI scan, and we have so many advances within MRI scans. For example, contrasts are used to highlight where the scar tissue is there for people who had a surgery. So we use these kind of advanced investigations. At our clinic, we also use very advanced spinal analysis. Digital spinal analysis is a very advanced investigation that we do. Which part of the spinal muscle is contracted? So we target our treatment to where the pain is. Once the target is identified, then we reach out to that place which is causing the problem. For example, if you have a discogenic pain and the gel is leaking out, we actually put a needle into the disc, do some treatment so that the disc gel is hardened. Once the disc gel is hardened, it's not leaking anymore. Thereby, you will reduce the pain of the patient, and also you avoid the surgery which is going to happen to the patient. So this is a remarkable thing that we can do. There is a number of techniques that we use. For example, there are certain chemicals that we use, gases that we use like ozone. Lasers are new advances that we have. There is electricity, radio frequencies. There is a lot of things that we use to make that gel harder, make the disc ring better, and also various other things like injections onto the nerves. These are the nerve blocks that we do. There are ablations onto the joints that you have. So there's a lot of things that we do, and when it is all coordinated to the requirements of a patient, you can avoid that surgery. That is
అంటే సర్జరీస్ ని అవాయిడ్ చేయాలని అందరికీ అనిపిస్తుంది.
Yes.
సో హౌ మచ్ సక్సెస్ రేట్ ఇన్ దిస్ పెయిన్ మేనేజ్మెంట్?
You would be very excited to know almost like 98% of surgeries, they don't need to be done at all. So most of the surgeries can be avoided. Only the ones, as doctors, budding doctors who are here, spine surgery is only indicated when you have weakness in your leg, and then your bowel and bladder, what you call it as cauda equina, when that is happening, or the bones are falling apart, what we call as listhesis. And these things are corroborated by your MRI scan, where you have a lesion that you can operate. Only then surgeries need to be happen. Otherwise, you are bound to have a patient who will be following for the rest of your career that you have done a wrong surgery for them, and now my condition is worse than what I was before. So we cannot let this happen. So basically, the surgery is a last option for all of us.
Right.